In this presentation, we're going to talk the provisional restorations for dental implant cases. Provisional restorations are used during the healing and osseointegration process to restore patients' oral function and to provide guide for the design and fabrication of the final restoration. There are many types of provisional restorations, from single crowns, bridges, full arch, Maryland bridge, partial and complete dentures, or immediate dentures. Also, the dental materials used for the fabrication of provisional restorations are very diverse, from tooth-shaded acrylic, PMMA for milling, 3D printed resin, composite resin, denture acrylic, and denture teeth. In general, the provisional restorations are part of the pre-op or before the surgery procedure. And this is done because when the patients are missing teeth or the natural teeth are extracted, we cannot send the patient home without any teeth. So provisional restoration also falls in the following category. They can be either fixed prosthesis or removable prosthesis. Under the fixed prosthesis, we can have single crown bridges or full arch bridges, Maryland bridges. Under the removable prosthesis, we can have partial, complete, or immediate dentures. So it's very important to understand when and how the dentures are going, the restorations, the partial restorations are going to be used during the osseointegration and healing process. According to the U.S. Air Force manual, it states that after the first stage surgery, the temporary or complete or partial dentures can be inserted when the sutures are removed, 7 to 10 days after the surgery. Provisional restoration are used during the healing and osseointegration process. Also, let's say a patient already had complete denture or partial dentures. Those dentures, they can be modified and adapted by the dentist to be realigned and used as a temporary restoration. Existing complete or partial dentures can be easily made to fit over the implant sites. Simply relieve the fixture area of the denture, acrylic, and reline it with soft tissue conditioner. Do not apply any pressure to the implant site at this time. If the acrylic is protruding through the soft liner, perform additional reduction and apply more soft tissue conditioner. Reline the denture in the conventional manner after 1 month. So in this case, when we're talking about using the relining material, usually after the surgery and during the surgery, the gums are inflamed. So we have to allow the denture to be soft, the part that's touching the soft tissue, the gums, so it doesn't hurt the patient. And also that allows the gum to heal faster. If the denture needs to be realigned because after the surgery and during the healing process, the gums, they're going to shrink, it's indicated to do a reline procedure again using harder acrylic after a month when the tissue or the gum, it's more stabilized. After the second stage surgery, at this point, the abutment and the healing caps are protruding to the tissue. So in other words, the implant was placed in the first stage surgery, and at the second stage surgery, the temporary abutments or the healing caps are placed in the patient's mouth to allow for reshaping of the gum and to protect the implant site to allow for the osseointegration process to take place. For complete dentures, relieve enough acrylic to see the dentures without any interference with the healing cap, and then reline it again with a soft tissue conditioner. So again, the same process take place where in the initial stage, we're going to use a soft material to reline the denture. There are many methods of doing the hands-on provisional restorations. So we're going to go through some of them as described in the U.S. Air Force Manual. So provisional restoration for a single tooth, cement retain implant. Those are the laboratory fabricated provisional or indirect method. First, take an impression and make a cast with a soft tissue section around the abutment replica. Next, place a temporary cap on the abutment replica and adjust the length so there is no interference with the opposing occlusal. So in other words, we're going to use a temporary abutment. Here it's named in the book, it's named a temporary cap, but that's referring to a temporary abutment. And the temporary abutment, usually it's a stock abutment, prefabricated abutment that comes in a certain length. And we will have to cut this abutment at the length necessary to not interfere with the occlusion. Okay, so if a light curing resin it's going to be used, it can be now applied, cured, and shaped to the desired contour. You may also wax up a tooth directly on the temporary cap and process it with a heat cure acrylic in the necessary shade. So in other words, we can do either wax up directly, wax up a tooth, a full contour directly on the temporary abutment, and then use matrix, lap putty to make a matrix, and remove the wax up, take the matrix, remove the wax up from the abutment, and then fill up the matrix with the tooth shaded acrylic, place it over the abutment, cure it, and reshape it, polish it, stain it, and glaze it, and the restoration is done. This restoration is called cement retain restoration because the restoration is inserted in a patient's mouth with a temporary cement over the abutment. Clinically fabricated provisional or direct method. Also, we can say this is done at the chair side by the dentist. So there are two methods of fabricating the restoration. Either the direct method, where it's done by the dentist at the chair side, or in the laboratory by the technician, and that's the indirect method. The dentist will seat a temporary cap or a temporary abutment in the patient's mouth. Then there is adjusted to the proper length. So again, that temporary abutment comes in a certain length and it has to be cut down to fit for the occlusal or the vertical dimension. A prefabricated crown shell is then selected to fit over the temporary abutment. Additionally, modification to the cap may be necessary or the abutment may be necessary at this point to provide for sufficient thickness of resin around the cap. And this is necessary sometimes because, let's say, the abutment wasn't placed in the ideal position. Maybe it's a little more lingual or a little more labial or buccal or lingual. So sometimes we may need to cut some parts of the, not only the length of the abutment, but sometimes maybe we need to reduce either the labial or the lingual aspect of the abutment to make the provisional restoration fit better over the abutment. The prefabricated shell is filled with acrylic or tooth shade color acrylic or resin, and then the resin is cured. The provisional then it's removed from the patient's mouth, trimmed, polished, and finish, and then it's inserted with temporary cement. So those are the indirect methods and direct methods of fabricating provisional restoration. So in the indirect method, like we presented before, that's in the lab where the dentist take an impression. He send the impression to us. We're going to pour up and make a model. And we use the stone model to wax up the missing tooth and then fabricate a lap body, remove the wax, and then fill up the matrix, the lap body matrix with acrylic, tooth shaded acrylic, cure it, and then remove it from the model, polish it, trim it, shape it, polish, stain and glaze, and then return it to the dentist for insertion. In the direct method, this is done, like I said, at the chair side by the dentist, and it's done using either acrylic, tooth shaded acrylic, or composite resin, using also the abutment, temporary abutment inserted into the patient's mouth. The dentist can use what's called the generic tooth shell, fills that tooth shell with acrylic, puts it over the temporary abutment, remove it from the patient's mouth to reshape it, trim the excess acrylic, polish, and then insert in the patient's mouth with temporary cement. Another method is to use, so that the previous method that we presented was about a temporary restoration used for a cement retain provisional. Now we're talking about a provisional restoration for a screw retain implant. The provisional restoration in both cases, they are very similar in terms of the fabrication method. But there is a little bit of a difference. So for a screw retain all acrylic provisional, we have to fabricate a cast with the abutment replica, properly position, and then articulate the cast. And this is exactly how we start any case when we're talking about doing provisional restoration. We always have to fabricate the cast. We can also use soft tissue casts, so it's much easier to mimic the natural gum of the patient. So it's easy to do the provisional restoration to fit exactly how it is in the patient's mouth with how the gum is presented at the time. Again, we're using a temporary abutment, which has to be cut down and also reshape in case that we need to reshape it in terms of the position, if it's more lingual or mesial or distal. So shape the abutment to have enough space to put the temporary restoration on top of it. We can apply heat cure or self-cure acrylic resin or composite resin to the temporary cylinder. Check the resin for occlusal lateral interference and aesthetic. So in other words, once we build up the tooth, the acrylic tooth or the composite, then we have to perform all the occlusal contacts or mesial and distal contacts, make sure that the contacts are closed, but also we have to keep in mind that the embrasures have to be, especially the gingival embrasure, have to be open so the patient can use a proxy brush to clean. Check the resin for occlusal lateral interference and aesthetic. Be sure to clean the access holes, thus enabling the guide pins or the gold screw to be removed and replaced easily. Finish and polish the provisional restoration. So the provisional restoration for a screw retain implant, it's held in place in the patient's mouth with a screw. So if for the cement retain, it's more aesthetic because the crown is fully contour and it's cemented over the abutment. For the screw retain restoration, provisional restoration, the restoration has the hole where the screw is attached. So the screw holds in place the restoration into the implant in the patient's mouth. Therefore, from aesthetic point of view, the screw retain its lack in aesthetics. So what the doctor does after it's inserting the um, provisional restoration in the patient's mouth, they have to cover the hole with tooth shade acrylic to kind of give aesthetics. Okay. For a screw retain cast framework provisional, so when we're talking about a bridge, fabricate maxillary and mandibular cast and articulate them with the abutment replica and analog in place. Position temporary cylinders or abutments and reduce them again. Cut the abutments at the desired length and also, if it's necessary, to modify them for the mesial, distal, lingual, or labial aspects. Okay. Adjust the temporary tubes or the temporary abutments to eliminate any occlusal interference. Okay. Wax up a framework over the abutments and place the copings or the wax ups with a connecting bar between the abutments. Sometimes we can do a connecting bar. Sometimes we can do what's called connecting between the units of each units of the bridge. In terms of the provisional restoration, when we have a framework, we really want that connection between each unit of the bridge to be very strong. And it's recommended, especially on the lingual side where it's not very visible, that the connections to be big. So to actually fill up the space between the teeth. On the buccal side or the facial side, we want to have the connection a little more thinner to have a little design. So when we apply the acrylic to build up, it kind of gives the illusion that the teeth are separated. So it looks more natural. It says here, wax up the framework with retentive beads. This is an old method that we used to do in the laboratory. Those retentive beads, there were very little balls that were added on the framework for retentive purposes for the acrylic or the composite resin. So it doesn't, separates from, it's kind of like a bonding agent between the abutment and the framework. After casting, make necessary, sprue and investor cast the complete framework utilizing the lost casting technique. After casting, make necessary adjustments to the framework to fit the temporary abutments. Place the temporary abutments over the replicas with long guide pins. The next step would be to cement the framework in place over the temporary abutments, and then the framework now it's ready for be cured, and then finish and polish it. So it's a little more involved technique because this can use a more involved procedure through waxing and sprueing and investing and casting procedure. Okay. A vacuum provisional fixed restoration can use resin-based indirect methods such as vacuum forming methods. So the first method will be to use a form vacuum method. The form vacuum method involves clear plastic sheets, more like the Invisalign type of, or the clear aligner type of plastic, and they're using in this method we're using what's called a vacuum forming unit that you're using has like a little platform where the plastic sheet it's holding place, it's warming up, and then once it's warm, it's under the vacuum, the pressure, it's pushed over the model, and it takes the shape of the model. Okay, so if the teeth of the dentist intends to prepare are broken down, complete and diagnostic wax up is necessary to restore the shape and make a nice diagnostic wax up. Duplicate this wax up in dental stone and make a clear matrix or a clear acrylic um, mold for the provisional restoration. To duplicate the wax up, that's another step that sometimes it's done routinely in the lab. So in other words, we have the preliminary cast. The doctor sends us the impression with the missing teeth. So we pour up that impression, we wax up the teeth, the missing teeth, and then now we're ready to duplicate that cast in dental stone. Why it's necessary for us to duplicate it is because, like I said, the vacuum forming method, it's using the vacuum unit to melt that sheet of clear acrylic. And if we use the wax mold that we have in there, the wax is going to melt and it's not going to give us the shape of the teeth that we want. So it's necessary for us to duplicate the model. So to duplicate the model, after we finish the wax up, we take an alternate impression of the wax up that we did, and then we pour that impression in stone. So now we have the same wax up that we did, but instead of being in wax, we're going to have it in stone, which is guaranteed to work very well during the forming vacuum method. If the provisional prosthesis is for a proposed fixed partial denture site, also we have to adapt mismatch uncarded the resident denture teeth to the edentulous space and adjust for the occlusion. So in other words, either we have two options in this case. When the first impression comes to us from the dentist and we have the missing teeth, we have two options. Either we can wax up the teeth, or we can use denture teeth to fill the missing teeth. Sometimes we may need to shape those teeth to fit in the space that we have, okay? Then take the cast off and its mounting and vacuum form the clear paint material over the cast. So during this time, once we have the duplicate the cast done, it's ready to be used into the vacuum forming procedure. So we can put the model in the vacuum forming unit, and we are gonna also introduce the clear plastic sheet. We're gonna warm up the plastic sheet, and then we're gonna press the plastic sheet over the model to take the shape of the teeth. It's going to be molded over the model. And once we have this done, we can remove it from the vacuum unit, let it cool and set for a few minutes, and then we can cut it to the desire and trim it, take out the excess clear aligner material. It's a little more involved, this method, and it has to be a little more involved in the sense that we're using different type of materials, and we have to be careful how we do the vacuum forming method. appliance. So this is how the vacuum forming method looks like using the wax up or the denture teeth that are placed in where the missing teeth are. So once we have the vacuum formed clear acrylic, then we can fill out the space where are the missing teeth with um, tooth shaded acrylic that looks more like the natural teeth. Um, this method it's usually done. It's a relatively fast way to do provisional restoration. But this method it's usually done especially for patients that, let's say, they had tissue graft, and usually during the tissue graft procedure, the oral surgeon takes cuts a little piece of the gum from the palate, from the patient's palate, and places where is necessary around the implant area. And for the patients to be able to heal, it's sometimes indicated to use those vacuum clear aligner because they can be set up to have the palate, so it protects the area where the doctor took that tissue. So when the patient eats, when the patient talks, it doesn't hit with their tongue on the area where the tissue was removed. So the clear aligner provisional restoration done this way allows for the healing process during the healing of the gums. Another method of using to do provisional restoration, it's also taking an alginate impression. So an alginate impression, it's a little faster method to do it. And in the alginate impression method, there is no requirement for intense heating of the template material. So we don't have that clear aligned sheet of the plastic that we're going to use. So in this method, we can use, again, we have the preliminary impression that comes from the doctor with the missing teeth. Now, the next step will be to wax up those missing teeth or use the denture teeth to fill up the space where are the missing teeth, right? And then we can take an alginate. So in this case, we don't need to duplicate the model into stone. What we need to do next is to take an alginate impression of the wax up that we did for the denture teeth that are placed in the model, then remove the wax up or remove the denture teeth, fill up the alginate impression with the acrylic, and place the alginate impression back on the model and cure the acrylic. So this is a faster method to do it. The only thing that we have to be aware of is that once we start taking the alginate impression, we have to work pretty fast because the alginate impression, it's a hydrophobic material. It likes water. And once the water evaporates from the material, that alginate impression material is going to shrink and is not going to be accurate. So once we start the procedure, we have to go ahead and finish it. Silicone template method, and this is probably the most used method when we use a lap potty to do provisional restoration. So Again, we start with the model sent, the impression sent from the doctor with the missing teeth. We're going to wax up or add denture teeth in the place where the missing teeth are, and take a lap potty, silicone potty mold of the area where we wax up the teeth, remove the wax up, fill up the lap potty with acrylic, cure it, remove the provisional restoration from the model, trim it, reshape if it's necessary to be reshaped, polish it, stain and glaze it, and send it to uh, the doctor for insertion. So, like we said before, we have different type of provisional. We have provisional for the fixed prosthesis and also provisional for the removable. The laboratory technicians, when we do talking about fixed prosthesis, we're gonna make the models again where we have the replicas inside, right? So the replicas shows us the position and the location of the implants, exactly how they are in the patient's mouth, right? So we're going to fabricate the master cast. We're going to mount it with the opposing arch on an articulator, and then we are ready to start fabricating the prosthesis. So like we talked before, we're going to use the temporary abutment, and we have to make sure that the abutments are cut down at the desired length. Also, if we have multiple implants, we have to make sure that the abutments are parallel with each other for uh, correct path of insertion, okay? So sometimes we may need, like we said, to trim those temporary abutments, not only to cut them from, the length to have enough occlusal clearance, but also mesial or distal, lingual or buccal, to have them uh, fit and be parallel with each other. So it says here the technicians uses one-piece abutment for cement restoration, for multiple implant restoration to decrease the use of abutment fixation screw loosening long term. So in other words, we can have this, the cement retain restoration, it's fixed over the temporary abutments. So it's cemented in there versus the screw retain that it's held in place with the screw. The technician might be fabricate two transitional acrylic prostheses, ideal for partially edentulous patients. The first transitional restoration in completely out of occlusion. So this is a very important point, but this sometimes this is required by the dentist to tell us if the first set of the provisionals are used temporarily, and the dentist, we would like to have the restoration of occlusion. So therefore, there is not too much pressure put on the implants during the healing and osseointegration process, okay? And also, once the osseointegration process took place, and let's say the patient still need to use the temporary provisionals for maybe other implants need to be placed in mouth, or additional surgeries will be necessary, then the second set of temporary can be fabricated, and then the second set of temporaries can be made more towards, having a centric relationship. But also keep in mind all the time, when we do, doesn't matter a provisional restoration or a final restoration for an implant case, we want the occlusal contact to be very light, so it doesn't put too much pressure on the implant, even if the implants are osseointegrated. We don't want to put too much pressure on the implants itself anytime. because that can lead to different problems from the implant screw being loose. Also, the restoration can be broken if it's too tight of the contact. When the patient buys down the temporary, it's plastic, so it's not so strong as porcelain or ceramic materials. So therefore, it can break very easy. So in general, for the temporary restoration, for the implant cases, it's recommended to be done off occlusion or a very light contact on the occlusal surfaces. In general, when we're talking about multiple implants, we want to do a restoration that it's a provisional restoration that it's splinted. So they're all gives a little more strength to the restoration. And also it fits better over their abutments. Okay. If a cantilever is present, no occlusal contact on the cantilever portions should exist. A cantilever is a tooth that it's placed on the restoration that has no, it's like a pontic, but it's a pontic that it's placed not in between two abutments. It's a pontic that it's placed either at the end of the bridge or at the beginning of the bridge. So one side of the pontic, it's not connected with anything. So in those cases where we have this type of cantilever pontic, we don't want any occlusal contact, okay? Because again, being the provisional material, acrylic, it's a not so strong material. If the pontic is made on the occlusal contact, strong on the occlusal contact, that may break, okay? Um, the final rotated position in the mouth is often different from the laboratory position, so the provisional restoration often requires a reline inside the patient's mouth. So this is the realignment, if necessary, is done by the dentist at the chair side during the insertion time. Laboratory steps following the first prosthetic appointment include pouring the preliminary impression with the implant abutment and implant body analogs in dental store. So this is exactly what we keep presenting, the idea that the dentist sends to us the impression with the missing teeth, then we have to fabricate a cast with the full contour teeth and then mount the case, ideal using a semi-adjustable articulator, using then insert in the model, insert those temporary abutments and use them as an anchoring for the temporary or provisional restoration. Okay. We talk about the pontics that are cantilever. So we have to make sure for those cantilever pontics, we leave them out of occlusion. We don't want any pressure, any force exerted over them, okay? Now, sometimes we're talking about provisional restoration in terms of preliminary work. It's good to keep in mind that provisional restoration, it's not only one set, okay, of provisionals. So sometimes, let's say we have a patient that wears denture for a long period of time. They came and they're good candidates for having dental implants. The doctor inserts the implants in, and then he or she modifies the denture to fit over the implant so the patient can use temporarily that existing denture as a temporary restoration. But meanwhile, we can, if the patient is going to go through a process of moving from complete denture to from removable to fixed, right? Because sometimes the patients, they want to get rid of dentures and have a fixed bridge in their mouth instead of, partial dentures or complete dentures. So in the initial phase, for the initial temporary, the patient can use the existing denture or partial denture as a temporary restoration. But then we can move, the doctor can ask us to do a set of temporary as a fixed prosthesis. And that it's very beneficial from different point of view. First of all, it gives us a sense how the final restoration is going to look. So the dentist is going to see how we design the final restoration. The patient is going to see how he or she's going to look with the final restoration. This is the time where we can make any adjustments. If the patient doesn't like the shape of the teeth, it's easy to change it in acrylic and have it ready kind of for the final restoration. So we know when we do the final restoration what the patient desires, right? And also during this time when we do the fixed provisional restoration and it's inserted in the patient's mouth, it's allowing the patient for a period of time to get used to come back from denture wearing to fixed. So it's going to take a little bit of time for the tongue and to for the patient to be reused to talk without the denture. Sometimes the palate it's covered by the denture, so sometimes the patient has trouble moving from a denture to a fixed in terms of speaking, because now the tongue has more space to move in. So using the provisional restoration as fixed, if that's the transition period, has multiple benefits, not only to give us an idea how the final restoration will look, but also to retrain the patient to use their mouth as they would have their natural teeth instead of a denture. Okay. So there are different type of provisional restoration, like we talk about single unit, multiple unit bridges, cantilever bridges that uses spontic either at the end. Most of the cases it's at the end of the bridge, so it could be posterior or anterior. Resin bonded bridges or Maryland bridges, removable dentures, immediate complete dentures. So there are different type of restoration, and we have to understand what type of restoration and when that type of restoration is necessary for the patient. The main idea of the provisional restoration is, first of all, to kind of give a little bit of oral function and aesthetic to the patient, but also the most important aspect is to protect the implant site. So to allow for the healing and osseointegration process without any interference of producing force over the implant or most important also the patient to be allowed to maintain oral hygiene. Okay, it's very important the patient is educated how to clean during this time of healing and osseointegration process. Okay, some of the restorations may also use reinforcements, and those are sometimes materials that are used to strengthen the provisional restoration, and there are using cases where the patient has to wear the provisional restoration for a longer time, or we know that the patient has a strong bite or suffer from bruxism, or if we're using a long span bridge, and there are multiple pontics, maybe we want to have that restoration a little reinforced so it's a little bit stronger. So for reinforcement, we have a different array of materials from wires and fibers. Um, the fibers should be, I'm sorry, both of them, the fibers and the wires should be braided, because if they're not braided, they're going to move inside the restoration. So they're not going to be stable, okay? Also, we can do a cast metal lingual wing. So this type of restoration, it's a little more involved in a sense that we have to wax up the lingual of our um, restorations. So we do a wax up on the model. Um, we remove the wax up, we invest it, cast it. Usually we use base alloy for this type of procedure. We finish the casting and then we use that to insert inside the temporary restoration. And that's the most used in cases where we need to have a strong restoration and also for long-term use of the restorations, okay? So again, also sometimes the doctor may ask us if we do a restoration, provisional restoration before the surgery is done. So the dentist has no clue yet where the implants are going to be placed, but they want us to have the restoration done because they can send the patient home without any teeth. So what they might ask us to do is to do an ideal provisional restoration that it's hollow out inside. Okay, so it's like an open shaft, like just like a shell. And during the surgery, after the implants are placed, the doctor placing the temporary abutments, and then he fills the open shell that we did for the temporary restoration with acrylic, places in the patient's mouth, and that's gonna set up the acrylic over the temporary abutments, and then doctor retrieve it from the mouth, trim the excess acrylic, polish it, and insert it in the mouth. So if we're looking at the pictures, the two pictures on the bottom of the slide, we can see the open shaft or the shell of the provisional restoration before the implants are placed in, and after the surgery where the implants are already placed in, and the doctor reline the temporary restoration over the temporary abutments. So this is ready for insertion. Okay, different other types of provisional restoration. So fixed and removable. We have on top the Maryland Bridge. On the middle of the slide, we have the provisionals. Sometimes for easy, it's kind of relatively easy to do, but also if we don't want to put too much pressure on the implant during the osseointegration process, a flipper can be used. So we can fabricate a flipper that it's a short temporary restoration that's used for few weeks or months, and then either the final restoration it's done or a new fixed restoration, partial restoration, it's done, and also the dentures. Okay. Another method of fabricating provisional restoration, it's using the CAD/CAM software. And here I'm explaining how to use the 3Shape system. So first of all, we have to set up an order. Now, everything starts exactly how it starts from our hands-on method with the impression. So the dentist can take a intraoral scanner. Okay, so he used an intraoral scanner to take a digital impression of the patient. In that case, when the case comes to us in the lab via the CAD/CAM system, the 3Shape system, the order it's already set up. So the doctor sends us the order. He's in charge of setting the order, and the order comes to us already. We just need to start working on the design and fabrication. In the case where the doctor takes a physical impression, right? Or sometimes they might do some offices, some practices, they might already put up their models. So when we receive a model of or an impression from the office, then we have to set up the order ourselves in the 3Shape or in any CAD/CAM system for that matter. So we start by setting up the order and choosing the right restoration and the material. Also, we have to be careful to put in the order, fill up the prescription. So in the comments area, we have to fill up and say what type of restoration we need. Also, the patient's name has to be put in the order, and the shade of the restoration, the number of the teeth for the provisional restoration, what type of provisional restoration, if it's fixed or removable, etc., etc. And the next step will be to scan the models. So we can use a laboratory scanner to scan either the models or the impression, the physical impression. And once we have the physical impression scanned, then we can choose the how we're gonna mount them. So when we do the scan, we're gonna scan first the working model, then the opposing, and then the bite. Okay, so it's very important to have those three elements well established before we start moving into the design form. So if we don't have, especially the alignment, the bite registration, how the patient bites down, right? It's the software doesn't know how to put the upper and lower together. So when we're gonna start working on the case, the upper and the lower can be in a different position, and that's gonna mess up the whole case. So it's very important for us to be aware that during the scanning procedure, we have to also register how the centric relation it's in the patient's mouth. Okay. So again, this is the phase where we're selecting what type of impression model, if it's a physical impression or a digital impression. We talk about this. All right. Very important also, sometimes we can do, for instance, we can do the design of the restoration, and we can send it to a third party or another lab to do actually the physical restoration. So we can do the design, but we can send it out to somebody else to manufacturing. So it's very important for us when we set up the order to select how we're going to manufacture this. If we're going to manufacture by ourselves in our lab, then we can choose the local milling or printing, okay? If we're going to select that, if we're going to decide that we're going to use a third party to do the manufacturing, then we have to make sure that we select who's going to manufacture. So we have to select the laboratory where the file is going to be sent. Okay. Very important when we do any type of restoration for implant cases, we have to match exactly the implant system used in the patient's mouth. So the size of the implant, the system used, everything has to match. Whatever it's in the patient's mouth has to be also in the order selected. Okay. So these are different type of scan bodies, or sometimes they're called locators. So they are used during the scanning phase to indicate where the implant is located and the position of the implant. Okay. So step by step, once we have everything set in the order, then the scanning are done. Now we're ready to move into the design phase. So we can select for the models to be trimmed and to be also smooth out if it's necessary. Some areas of the models maybe need to be smoothed out if we're going to print out the models. So we have different tools at our disposal in the software to work not only on the model work, but also on the final restoration. So when we're ready to do the design of the restoration, we have to establish the path of insertion and, very important, the margin, okay? Usually the software will generate the interface where the margins and the covering of the preparation is shown. And this is the preliminary work, and it's going to show us the pre-order, pre-design phase, okay? So it's kind of like we give the software an idea of what we want, okay? The technician designs the digital provisional restoration. The design should follow the shape of the existing dentition function, including articulation and margin finishing, just like the conventional method. So when we do a wax up, how we do the wax up, right? We have to be careful how to match the natural shape of the patient's teeth, okay? What's good about using the digital method, it's also that in the software, there is what's called a library where there are different digital shapes of teeth. So let's say a patient has worn out teeth, so doesn't have too much, patient doesn't have too much anatomy, right? Excuse me. We can look into the library and find teeth that are not so they don't have too much anatomy, so we can match very easy what the patient has. Also, we have an array of tools that we can choose from to have the perfect margin, to also shape the restoration like we want in terms of the occlusal contact, mesial and distal contacts. So it's exactly like we use a carver when we do a wax up, the same on the digital, the CAD/CAM software. We have an array of tools that can help us shape the design of the restoration. And then the restoration is sent into either milling or printing. So what's important for us to understand Milling means it's called a subtracting method because it cuts off material from a disc or a pack of plastic. Or we can use printing method. The printing method, it's called adding, because during the printing, the 3D printing, the printing takes place by adding layer after layer after layer of um, plastic to build up the restoration. Okay. And once we have it either printed or milled, it can be finished, polished, also stained and glazed, and then it's ready to be sent to the dentist for insertion. Another method of fabricating provisional restoration is also a combination of both digital and hands-on. And we talk about this method where the doctor sends the physical impression to us, and then we use the CAD/CAM to fabricate the final provisional restoration. All right, so this is the presentation about provisional restoration. If you have any questions, please ask them during the lecture. Thank you.